In terms of thinking about chemotherapy for gastric and GE junction cancer, we now have options, multiple options through multiple lines of therapy, and that's a great thing. And I think that similar to how we think about in colon cancer, we want to strategize and begin sequencing treatment and plan ahead. So if a patient is PD-L1 positive, then I know pembrolizumab is an option in third-line setting. I typically would do a platinum and fluoropyrimidine in first-line setting, paclitaxel and cerims in the second-line setting, and pembrolizumab in the third-line setting. That leaves out irinotecan. And that's okay for most patients, but if a patient is really quite robust and quite motivated, that may be an option to do a 3-drug regimen in the first-line setting, and then use irinotecan in the second-line setting and the pembro in the third-line setting. So I think these are things we have to think about and discuss with patients. The goals of care through the lines of therapy, second and third line, remain the same. How do we maximize their quality of life and maximize their disease control duration and minimize side effects of treatment? We're trying to use more and more targeted agents, less and less chemotherapy to reduce side effects. Neuropathy can be a problem, especially after you receive oxaliplatin for a while, Taxol for a while. So we have to think about that as well. But with these options, we have an opportunity to discuss with our patients our goals of care and how best to manage and sequence. Immuno-oncology has changed the face of solid tumor oncology. Recently, the FDA approved pembrolizumab for any tumor that was mismatch repair deficient. These tumors have a high neoantigen burden, and there's really quite compelling data that pembrolizumab in that setting can induce a response in about 30 to 40% of patients, and the response can be durable. I'm talking years. So that's really practice changing. But outside of that, pembrolizumab really has modest activity. Really, it's 10 to 15%, at least in the third-line setting. In the second-line setting, the study comparing it with chemotherapy was negative, in fact. So patients commonly ask, can I get pembrolizumab in the first-line setting and second-line setting? And we review the data and explain to them that their chances to control the disease, have a better quality of life, or better with chemotherapy, at least at this time.